It looks like we are live. I had a little glitch in the video here. Welcome, happy Friday. I'm happy to be back live after being on vacation in Kauai for a while, a much needed vacation. And thanks for joining me live. If we haven't met, my name is Julie Hirschberg, and I'm a neurologic physical therapist, and always excited to hear from my fellow therapists, their questions, and then to talk about them. And so today's live comes from a fellow therapist question. It was such a great question, and it hit so closely to the topic that we've been talking about a lot, which is dizziness and chronic dizziness and migraine and functional neurologic disorders, that I wanted to talk about it today. And that is the topic of high intensity training. If you are in really any of the therapy worlds, but particularly in the neurotherapy world, high intensity training is all the rage. It is like get people up, moving, high intensity, even acutely high intensity gait training. And for a good purpose, we know that high intensity training and repetition is one of the key components that can drive neuroplasticity. It is so important. But it's not for everyone. And it's actually quite a mindset shift to go from a really high intensity mindset to a very slow and low mindset for a lot of other disorders. Today, we're going to talk about vestibular migraine, but I got to tell you, this applies to many disorders. So functional neurologic disorders, hypermobility disorders, dysautonomia and autonomic disorders, some of the chronic conditions that we can see post-infection, for example, where high-intensity training is actually contraindicated. Now, it doesn't mean that if you have a person with dizziness, they would never do high-intensity training, or if you have a person with functional neurologic disorders, they would never do that. But that is not typically the course of action that they need initially to drive neuroplasticity. So when we think of those principles of neuroplasticity, intensity and repetition is one of them, but so are other things. And those other things are what are actually more important in some of these disorders. And that includes salience for the person. So I want to highlight a quote here. I'll bring up the quote and then I'll share a little bit of the article. This quote was from the article, and I'll pull up the article is free, full text, by the way. I'll put it in our newsletter today. Care gaps and recommendations in vestibular migraine, an expert panel summit. But they said at the end, in talking about the needs for treatment for vestibular migraine, they said rehabilitation should be conducted by experienced therapists who will be able to increase the dose of exercises to avoid causing significant symptoms, not no symptoms, but significant symptoms, since these patients are generally very motion sensitive. And so we could, by the way, like replace this with another disorder. And we could say this is about folks with hypermobility or dysautonomia. Or functional neurologic disorders. So it's not that we avoid all symptoms. That's not the purpose of therapy. But we do want to provide that person the ability to have an off switch for their symptoms, to bring them slightly into their symptoms, but have some tools for nervous system regulation. You cannot train a dysregulated nervous system. And in these disorders, this is different than some of the disorders that so very much benefit from high intensity training. They don't have nervous system dysregulation to the extent that other disorders do, particularly folks that have migraine, folks with functional neurologic disorders, folks with things like CRPS, chronic dizziness, 3PD, concussion, we cannot apply those same principles. So let me show you the article here. Where this came from. And this was actually shared to me from Jamie and Catherine, who are doing our free webinar, which is tonight. The Otolith mixtape is tonight. I'm so excited. Y'all, I've looked at these. If you're a therapist, I've looked at these slides and they are golden. There's so many great nuggets in here. But they actually shared about this article and the recommendations for rehabilitation. This article went through a lot of the care gaps, and intervention is one of the key care gaps. I think this is care gap number 6 in vestibular migraine, is lack of appropriate combination of pharmacological and non-pharmacological measures to treat vestibular migraine, as well as an appropriate stepwise management algorithm. This is where they talk through the recommendation to have an experienced therapist that can truly lead somebody through a stepwise progression, which, by the way, is what Jamie and Catherine are going to talk about tonight. But the piece I really wanted to drive home was the nervous system regulation piece. And so I think, no, I do not have another picture. Let me just stop sharing here at the moment. So when we talk about this slow and low is the way, what we've already talked a little bit about who this is best for. So obviously from this article, the recommendation, this is very helpful in vestibular migraine. We see this very helpful in other forms of dizziness as well, particularly 3PD. But there are other things, so like Maulde-Barkman syndrome. We see this really helpful in functional neurologic disorders, in CRPS, in post-concussion symptoms as well. Ehlers-Danlos syndrome, hypermobility syndromes, postural orthostatic tachycardic syndrome, mast cell activation syndrome. All of these folks can better be served by a slow and low approach versus a high intensity of training approach. Again, not to say that they might not get there, but to start slow. How do we know? How do we monitor this? So we can use symptoms for monitoring, but I actually love to use physiologic measures as well. So we will use heart rate variability very closely because it's a direct measure of autonomic activity. When it comes to migraine, we know there's an autonomic trigger and activity. And when it comes to many other disorders, we know there's an autonomic component. So we'll use heart rate variability monitoring. You can do it with a polar heart rate monitor. We use the Leaf for this. You can even do it with your Apple Watch. But that has been really helpful for us to get a baseline and then to look at that measure as the person moves through activities. So it's nice to have that versus just symptoms because it actually keeps the focus on a different outcome. So the focus can be on the activity and the goal versus a body-centered focus, which is very symptom-oriented. So we'll monitor it. And by the way, we can use heart rate variability monitoring, but we can also monitor just with heart rate, though I particularly love heart rate variability because it's more autonomic. Getting a comment here, a person with FND, slow and low is so important. So lived experience. Thank you for sharing that because I think, for me, because there's not a lot of large randomized controlled trials in some of these patient groups, a lot of what I learn is from people that I am working with, right? I learned very quickly. Look, I was a part for 5 years of a high intensity gait training study for people post-stroke. That is like in my veins, in my blood to do. I learned very quickly that is not beneficial in like people with FND. So we become flexible as therapists, right? What we learned and did doesn't work for everybody, right? And we're flexible. So we talked about who it's best for, this low and low, how we might monitor it, and how we might start, I think, is so important. And so another therapist and I were having an online conversation about this, and it's really helpful to first get that baseline. So for example, we use the Buffalo treadmill test a lot for exercise tolerance. It's from the post-concussion world, but we use it with a lot of folks because then we can actually see symptoms at a particular heart rate. And so we can use that heart rate zone. We could use an RPE zone. That's another way to monitor it. So that's a good place to start. But I always want to, and I learned this from Jamie and Catherine, have an off switch. Usually this is through exploring autonomic and sensory techniques for nervous system regulation. So whether those are grounding, sensory grounding techniques or weighting techniques, I want to find those and discover those with the person in front of me. Everybody is very different, but that is the first step so that I can help and work with that person through nervous system regulation so we can move into symptoms, so we can move into activities where that might be really scary or trigger symptoms, but then come back down. So that is really, really important place to start. And let me just give a few examples of what those nervous system regulation techniques might be. So we've talked about these, and I won't demonstrate all of them, but for example, they could be a sensory awareness technique. So there's something called a 5-4-3-2-1, which is looking and using other sensations. So this is really, really helpful when a person may have difficulty with sensory integration, where they're naming 5 things they can see and 4 things they can smell and 3 things they can touch and so on. That can be a really helpful one. By the way, we work really closely with our OT team who does an assessment of sensory integration and their profiles and their sensory processing, so we can know where to start with some of this nervous system regulation. And yes, this is slowing down. It's so different from high intensity training, but honestly, as a physical therapist, still so important and so helpful to our patients and so rewarding. I really love incorporating these pieces into treatment. But again, this wasn't part of my training. I had to do a lot of extra training, a lot of learning from my OT and psychology colleagues to learn these pieces of the puzzle. So sensory grounding techniques like the 5-4-3-2-1, sometimes weighting, so a weighted vest, a weighted blanket, weights in the hands. Jamie and Catherine are going to talk about this tonight in our webinar, how weighting can be helpful in the nervous system, particularly in dizziness. So that's another piece that we may start with from a nervous system regulation. Sometimes movement is regulating. Movement's very regulating for me. It's different for each person. So again, that's why this is so individual. So maybe part of the nervous system regulation is rocking or dancing or even jumping. And so you might think that there's a level of intensity to that. And so we have to think about that on multiple levels. We might watch that person's heart rate as they're doing that type of activity. Maybe it's a rocking in the rocking chair, for example. Maybe it's no movement at all. So sometimes some of the regulatory activities are supportive, like laying down with the head supported. That can give a lot of sensory input to the head and neck, which can be really helpful for a person that's dizzy. There's so many ways that we can promote nervous system regulation in a person-specific way. As usual, it really takes a very thorough assessment to know what is most helpful for the person. And sometimes it takes trial and error to try these things and actually see if they're regulating and helpful for the person, or maybe they're not. I spoke to a person this week who has persistent post-concussion symptoms, and waiting really made some symptoms worse. And that told me a lot. I actually think it was because it was related to their neck. I don't think all weighting is necessarily bad for this person, but it was where the weights were. Again, I don't just throw weights on everybody or have everybody breathe or try mindfulness. That's not very informed by the person. So you really have to take in to understanding what that person needs. And again, using the adult and adolescent sensory profile that our OTs do really regularly with our patients can be really helpful to give us information about what that person might need from a nervous system regulation standpoint. And then when it comes to actually progressing, we will use those parameters of their heart rate variability, and tolerance for those activity, their recovery from that activity. We'll use all of those pieces to really progress. For some of the folks, I know this is not a talk on POTS, but for some of those folks, we are progressing extremely slowly through that exercise progression. And I highly recommend, if this is new to you as a therapist, for looking at some of the literature for progressing activity for somebody who has autonomic dysfunction. There's some really nice exercise progressions that have been published, but again, doing it individualized, really, really helpful. Now, what does this mean? It means that a person's recovery process might be slow. It might mean they need a lot of space between appointments. And that's also totally okay. That's how slow and low goes. And I will say, for some people, as we start off that slow and progress, that person is able to tolerate more and more. And yeah, they're back to running, or yes, they're back to, I have one of my favorite people that I worked with who had really severe dizziness in 3PD. He's doing aerial acrobatic yoga and aerial art. So it doesn't mean that high intensity activity is out of the picture for that person. It's just usually not where that person needs to start if their nervous system is dysregulated. So I hope that was really helpful for you to kind of compare and contrast the high intensity, the versus low intensity, and where you would do that in what populations. I would love to hear from you. If you have questions about this, please reach out to me, send me a message. This is, as I said, like I've been a PT for many, many years. I've worked in many settings. I've done all aspects of this, and this was something that was new to me a few years ago too, and I didn't really understand it and didn't know how to incorporate it. And I think it's really important for many of our patient populations. And again, if you want to learn more, particularly in incorporating this with dizziness, if you're a therapist, we have a free webinar. It is tonight. It's at 5 p.m. Pacific time. It's the Otolith mixtape, to where you're going to discover with Jamie and Catherine some ways you can help get immediate results. I mean, like literally immediate, because I've used this. I've used a lot of what they've taught me with the most complex patients, and a lot of this slow and low approach too. So it's going to be great learning tonight. It will be recorded, and the recording is available through July 18th as well. So join us tonight. I'm so excited for this, and please continue to reach out with me, to me, and our team with questions. We love talking about this, and thanks so much. I hope you have a great Friday, a great weekend, and I will see you next week.